What's the deal with anal sex? And how do you actually stay safe when you're having it? It's one of those topics that everyone's curious about, but almost no one talks about openly. Some people whisper, others search it up late at night. But when it comes to real information, there's a lot of confusion and even shame. So today, let's change that. I'm Dr. Emily Carter, and we're going to talk honestly, clearly, and without judgment about anal sex, what it is, why people do it, and how to make sure you're doing it safely, comfortably, and confidently. Anal sex means the insertion of the penis, or sometimes a toy, into the anus. And let's be honest, it's something people have a lot of curiosity about, but very little clear information. Some people try it because it feels new or different. Some say it helps them feel closer to their partner. Others are simply curious, or they've seen it in media and want to understand what the experience is like. Whatever the reason, the key is there's nothing strange about curiosity, but there is something important about doing it safely. Unlike the vagina, the anus isn't designed for penetration. It doesn't create its own lubrication. It's lined with delicate tissue and surrounded by muscles that are meant to keep things in, not let things in. That means you need patience, preparation, and communication. When people skip those steps, that's when pain happens, or worse, injury. But when done correctly, slowly, and with consent, anal sex can be safe and even pleasurable for many couples. And remember, this isn't about being wild or taboo. It's about understanding your body, listening to your partner, and taking charge of your sexual health with awareness and care. People often think anal sex is some kind of modern trend, something that only showed up in the last few decades. But the truth, it's been part of human intimacy for thousands of years. Archaeologists have found ancient Peruvian pottery dating back to around 300 AD, showing couples engaging in anal intercourse. In China, during the 16th and 19th centuries, it appeared in hand-painted scrolls and private art. Later, in France, during the 19th and 20th centuries, it was even captured in lithographs and early photographs. So no, this isn't new. It's just that, for most of history, people didn't talk about it openly. Society wrapped it in silence, calling it forbidden, dirty, or deviant. But behind closed doors, curiosity was always there, just hidden under layers of judgment. And that's why conversations like this matter today. Because the act itself isn't the problem, the silence is. When people don't talk about it, they don't learn how to stay safe. They don't learn that there are ways to prevent pain, infection, or emotional discomfort. So by breaking that silence, we take something secretive and turn it into something responsible and human. Before anything else, before touch, before curiosity turns into action, comes one thing: consent. Anal sex isn't something that should ever just happen. It requires clear, honest, and ongoing communication between both partners. That means not just saying yes, but making sure both people actually want to do it, not just agreeing out of pressure or curiosity. Start with a conversation, one that's open, calm, and judgment-free. You can say something like, "Hey, I've been curious about trying something new. How do you feel about that?" Or, "Would you ever be open to exploring this? Only if we both feel safe and comfortable." And here's something most people forget. Consent isn't only verbal, it's also physical. If your partner tenses up, pulls away, or goes quiet, that's a no. Even if they said yes 5 minutes ago. Here's something most people don't realize. The anus wasn't designed for penetration. Unlike the vagina, it doesn't produce its own lubrication. That means without help, friction can easily lead to pain, tearing, or even infection. So if you remember one rule from this video, make it this one. Always use lubricant and use more than you think you need. Let's talk about how it works. The tissue inside the anus and rectum is thin, fragile, and full of tiny blood vessels. That's why you might notice small spots of blood if things get too rough. The skin tears easily. Lubrication creates a protective barrier. It helps reduce friction, allows smoother movement, and makes the entire experience safer and more comfortable. But not all lubricants are created equal. Water-based lubricants are usually the best starting point. They're easy to find, safe to use with condoms, and they match the natural pH of the anal canal. The only downside, they can dry out quickly, so you'll need to reapply every few minutes. Silicone-based lubricants, on the other hand, last longer. They're great for longer sessions and feel extra smooth. But, and this is important, they can damage silicone toys, so only use them if you're not combining them with those kinds of materials. And then there are oil-based lubricants, like coconut oil or mineral oil. They feel rich and last a long time, but they can break down latex condoms, which increases your risk of STIs. So only use oil-based lubes if you're not relying on latex protection. The bottom line? Lube isn't optional. It's essential. It's what makes the difference between discomfort and safety, between pain and pleasure. If something feels dry or starts to sting, stop and add more. Your body's telling you it needs help. Listen to it. Now, let's talk about something that a lot of people overlook: condoms. You might think, well, there's no chance of getting pregnant from anal sex, so why use one? And technically you're right, but that's not the point. Anal sex carries some of the highest risks for sexually transmitted infections, even higher than vaginal intercourse. Here's why. The lining of the rectum is incredibly thin and delicate, much thinner than vaginal tissue. When friction happens, it can create tiny tears, often too small to see or feel. Through those micro tears, viruses and bacteria can enter the bloodstream. That's how infections like HIV, HPV, gonorrhea, chlamydia, and syphilis can spread. And because the anal canal doesn't self-lubricate, that risk increases when people skip lubrication or go too fast. That's why condoms are absolutely essential, even for couples who trust each other. They don't just protect you from infections, they protect your partner too. If you're using condoms for anal sex, here are a few key things to remember. Use a new condom every time. Never reuse one. Always pair it with lubricant. Friction weakens latex, making it easier to tear. If you switch from anal to vaginal sex, change the condom. The bacteria from the rectum can cause serious vaginal infections if transferred. And if oral to anal contact is involved, what people sometimes call rimming, use a dental dam. It's a thin latex sheet that acts as a barrier, reducing the risk of oral transmission of viruses or bacteria. If you're curious but new to anal play, here's one thing to know right away. You don't start with penetration. Your body needs time to adjust, to relax, and to learn a new kind of sensation. Think of it this way. Every muscle in your body can be trained, and the muscles around the anus are no different. They're designed to stay closed most of the time, to protect your body. So the first step is teaching them to relax safely. Start small. A single lubricated finger is often enough to explore and understand how your body responds. Move slowly, breathe deeply, and focus on how it feels, not how far you go. If your body tightens or tenses up, pause. That's your cue to slow down or stop. Once you're comfortable, you can move on to toys, but not just any toy. Anal toys are specifically designed for safety. Look for one with a flared base, a handle, or a retrieval ring at the end. This small feature is essential. It prevents the toy from slipping too far inside, which can happen more easily than you might think. Without that base, the toy can get lost in the rectum, and yes, that means a trip to the emergency room. After any kind of anal play, what you do afterward is just as important as what you did during. This part, often skipped or forgotten, is called aftercare. And it's not only about hygiene, it's about physical comfort and emotional connection. Let's start with the practical side first. Once you're done, take a few minutes to clean up gently. If you use toys, wash them right away with warm water and mild antibacterial soap, or use a dedicated toy cleaner. Make sure they're completely dry before you store them, and never reuse a toy between partners without disinfecting it first. Here's something I tell every patient. Pain is not part of healthy sex. Discomfort can happen, especially the first few times. But sharp pain, burning, or bleeding is your body's way of saying, stop. If you feel pressure that doesn't ease up, or if your partner seems tense or flinches, don't try to push through it. Take a breath, slow down, add more lubricant, or pause completely. The goal isn't to get there, it's to make sure both people feel safe and in control. So here's what I want you to take away from this conversation. Pleasure and safety aren't opposites, they belong together. When you communicate, when you prepare, when you listen to your body and respect your partner, anal sex can be a healthy, safe, and even meaningful part of your relationship. It's not about being edgy or rebellious, it's about understanding your body and honoring it. And if you ever have questions about safety, anatomy, or recovery, don't rely on random internet myths. Talk to a doctor or look for credible, evidence-based sources. You deserve real answers, not judgment. If this video helped you understand your body a little better, give it a like, share it with someone who could benefit, and make sure to subscribe. Because every week, we talk about topics that empower you to live healthier, safer, and more confidently. Take care of yourself, because you're worth it.